Okay, welcome everybody to the Older Vermonters Caucus. Thanks for being here today. We're going to have some guests from the Alzheimer's Association. I guess we can start if anyone has any short announcements or anything they'd like to make before we get going here. Letting some people are still coming in. All right. Well, I will turn it over to Jennifer from the Vermont.
Sir, Keaton may have gone off mute.
I'm off mute. I think everyone online can hear me. Is that true? Somebody?
Yes, can hear you.
Fantastic. Thank you, Sarah. Yep. I'm going to turn it over to Jennifer from the Alzheimer's Association. Thank you so much for being here. You can sit in the middle of the table. You can join us on the side.
Right here. Thank you so much, Representative, for having me and a number of my staff colleagues who are on the call as well. For any of you that I haven't had a chance to meet yet, my name is Jenny Horgan and I do our state government relations work here in Vermont for the Alzheimer's Association. So just to give a little context background information, we have our facts and figures sheet, which I'm happy to pass around. It talks about the impact of the disease on the state. There's over 12,800 Vermonters living with the disease. That's over almost 10% of the population 65 and older, and it being an older state that does provide a significant, aspect of the population that is living with this disease, along with 20,000 unpaid care partners that support people living with Alzheimer's and dementia across the state. So those care partners, they provide over 29 million unpaid hours of care, and that equals an unpaid value of $773 million that they are using to care for people living with the disease in their home and in many different facilities, avenues that they're existing in and people living with the disease are in. Caregiving is an incredibly hard and challenging job. We often find that people who care for people living with Alzheimer's have higher rates of chronic disease, depression, poor physical health than people caring for other people who are living with diseases or challenges beyond Alzheimer's and dementia. It's 24/7. You are constantly needing to provide support and care for someone living with the disease. In terms of the landscape for workforce support, we know that often people living with the disease interface with our healthcare network. Often there's about 20 geriatricians in the state, and we do need a 20% increase in that to meet the demand by 2050. There are also 7,460 home health and personal care aides, and we need a 28.7% increase of that number to meet the needs of 2032. In terms of the healthcare system in general, there are a huge amount of costs related to Alzheimer's and dementia. So the Medicaid cost for caring for people with Alzheimer's and dementia in 2025 alone in the state is $158 million. So the impact of this disease is huge. The fact that we are an older state, we only see this problem as continuing to grow and rise. It is a very hopeful time in terms of research and treatment on Alzheimer's and dementia. We do have 2 FDA-approved treatments that treat the disease best at the earliest stages, and we have a lot of advances in terms of diagnosis that include biomarker testing, blood-based biomarker tests that can detect the disease when someone is showing symptoms. It is FDA approved, and there are so many exciting advances going on that can help manage the disease and can help to, hopefully, move us towards closer to a world where Alzheimer's is not something that we have to deal with and live with. So that's a very broad overview setting the landscape. I'm happy to chat about our legislative initiatives here, but we also have my staff partner, Joe Cotto, who runs our programs and services in the state, who could speak to the services and supports that the chapter offers. If we want to go into that first before jumping into our legislative priorities, it's
Sure.
absolutely
Sounds great.
okay.
And I put a link to a recent story about caregivers that was on Vermont Public Radio. I put that in the chat along with the AARP report that just came out. So I just put those both in the chat. But please go ahead.
Can you all hear me okay?
We can.
Okay, great. I love when technology works. Good morning. Hi, everybody. I'm Jordan Cotto, the Senior Program Manager for the Alzheimer's Association Vermont chapter. Thank you for having us today. We're located in Williston. I always add that because sometimes people ask, and it's good to know where we're located. And my role is to work with volunteers statewide who facilitate in-person caregiver support groups and virtual, and also facilitators who support community members in all aspects. And then also education programs that we offer, including Know the 10 Signs, and our most recent one is about prevention, healthy habits, brain builder. I highly recommend that one. And then we have an awareness presentation for any audience to get started and hear all about our resources. And I just wanted to quickly share the areas of Vermont where we have support groups for those who want to engage with that. We have Burlington, Brattleboro, Danville, Enosburg, Newport, Middlebury, Shelburne, St. Johnsbury, Williston, and Woodstock. So most people only have to drive hopefully less than an hour to engage with these support groups, and we really appreciate that all of our volunteers are so helpful in that area. And I think that, I always like to do our last and next. Our last program was in Ludlow to a wonderful group of volunteers who facilitate at memory cafes there. And that was about behaviors and how to support families with behaviors. And our next program is actually on Monday in Charlotte, which I love visiting Charlotte. It's so beautiful there. And that is for anybody who wants to come and hear more about the Alzheimer's Association. It's at 6:30 and it's at the library there. So thank you so much, Jenny, for letting me share. Appreciate it.
Could you expand a little bit on the memory cafes? Is that something that you could just give us a little background on, or?
Yeah, and actually that's something that I personally manage. That's through the UVM Center on Aging. So if the Memory Cafe is starting in a community, part of my role is to offer the facilitators training, and there's a list of memory cafes on the UVM website. And I think there's about 13,
what exactly
13
are
of them
they?
statewide. Yeah, it's a resource for caregivers and their loved ones that they're taking care of, loved ones who have dementia. And they're usually about 2 hours from 11 to 1. And it's caregivers go to one area, loved ones go to the other area. And sometimes there's music or activities for loved ones. And it's really a chance, my understanding is a chance for caregivers who maybe can't leave their loved ones alone to engage with other caregivers.
Great. All right.
Yeah.
And there's a list of those on the website.
Yeah, on the UVM Center on Aging website.
Fantastic.
Yeah.
Yeah, go ahead.
Question, I'm wondering, in addition to those in-person meetings, either through memory cafes or the other the locations around the state, are there online support groups that you run?
Yes, there's many. There's a lot of virtual opportunities. If you go onto our website, you can navigate right to virtual support groups, and the platform is called CareLike, and you can there's support groups for all different walks of life. Let's say if you're a single parent and you're in sandwich generation, there's a support group for that, and they're all virtual. What you're talking about. There's a group for people who identify as men. There's many different options. So I highly recommend looking into that. We just saw one actually through our main chapter for LGBTQ plus for individuals that want to engage with that as well, with that resource as well.
Thank you.
Thank you.
You're welcome.
Thanks so much, Joe. We're certainly very lucky to be able to offer these supports in community virtually. It's so important for people living with disease and their care partners to have an opportunity to engage in community, to have an opportunity to not feel isolated or alone. And often we do find that caregivers and people living with the disease, feel very isolated, feel very alone on their journey of living with the disease. And, being able to, the amazing work that Joe does and the rest of the team does to support them and really be boots on the ground is so vital. So we're very lucky to have Joe and the rest of her team that offers those supports. I know there's a couple other members of staff on the call. I don't want to put them on the spot, but if they want to jump on maybe and talk about any of the other community work we're doing. I see Jasmine and Amy.
Hi, everyone. Can you hear me fine?
Yes.
Fantastic. So my name is Jasmine Ferrari. I'm a development manager with the Alzheimer's Association Vermont chapter, and I work throughout the state, specifically in fundraising. So we have lots of really fantastic ways to get involved through volunteering and fundraising. Some of those are coming up very quickly, and some of them are a little bit further out. I just want to kind of touch on just three different things. One is the Reason to Hope Gala that is coming up on April 30th in Essex, Vermont at the Essex Resort. Tickets are on sale and information is on our website, but it's a night of dancing and entertainment and just getting to talk about our stories and our connections. And there's a silent auction. It is a fundraiser for critical funds to help support the programs that Joe just spoke about, as well as research done worldwide for the treatment and hopeful cure for Alzheimer's and other dementia. So that's coming up. If you have any questions about that, you can contact us online. Two other opportunities that you could take part in is our Walk to End Alzheimer's. We have 3 walks in the state in Rutland, the Champlain Valley, which is at the Shelburne Museum, as well as the Northeast Kingdom, which is up in St. Johnsbury. And to get involved in that, you can go to our website and register a team, and you can walk as a part of the event. You can fundraise to add to your team's collection. And again, those critical funds are going to programs and opportunities for our immediate community to have free access to those resources. And a third opportunity for you is also in a fundraising realm. It's called Do What You Love to End Alzheimer's, where you get to choose your own hobby, the things that you love to do, and you get to take those and put them to action. So you work with me personally. We get you your website all set up, and I can help you figure out a either passive or very active engagement in fundraising using your own interests, hobbies, passions to really make a difference for that. And all of these opportunities, if you're not able to partake as a participant, we always are looking for volunteers to help out in planning the events, getting information out and sharing what's going on in the community. So we would love for you to help in any way possible. There are also links now in the chat. Thank you, Joe, for Reason to Hope and all those other ways that you can get involved. So please do reach out if you want to do that.
Great.
Yeah, the team does a great job, and I love Walk. Walk is always such a community building experience. We have so many people show up and really support each other, and it's really hopeful and an amazing opportunity for people to feel supported and feel, part of the community. So thanks, Jasmine. Amy, anything else you wanted to add before I can jump into the legislative stuff?
Hi, my name is Amy Joseph. I work in the chapter office as the support staff, so I'm involved in a little bit of everything of what Joe and Jasmine have just spoken about. I came to the chapter as a volunteer initially and felt very connected to the mission since I lost my own mom to Alzheimer's a few years ago. But there's a lot of great work being done here on the part of this group, and there's lots of great events coming up, and we appreciate all the support we get in Montpelier and look forward to the year's coming events. Thanks, Jenny.
Thanks, Amy. So speaking of events, our Alzheimer's Advocacy Day is tomorrow, which we're so grateful for Representative Noyes for sponsoring our resolution for tomorrow. I know it's, coming to the House chamber and having, our advocates recognized and really, elevated in that moment is so impactful. It means a lot to them. So we're incredibly grateful for that and for the opportunity to talk about our legislative priorities. You're good to get involved in that. Okay. So we're working on a number of pieces of legislation this year. Our our two biggest ones are biomarkers and dementia respite. So the biomarker bill, S-154, made it out of the Senate, is currently in the House. It has a hearing tomorrow. This bill initially, as introduced, was a bill that would require public and private insurance to cover biomarker testing. And specifically for Alzheimer's, this is a bill that would cover all different types of diseases. It's part of a coalition group that we're working on with the American Cancer Society and a large number of other specialty organizations that are addressing different diseases across the country. For Alzheimer's specifically, I know I touched on earlier that we have treatments now available that work best in the early stages of the disease. So it's really, really vital that we have, a diagnosis as early as possible for someone so that they not only can access treatment if that's appropriate, but also have time to plan, time to, decide how they want to live their life. And then we also are seeing a lot of information coming out regarding preventative steps that you can take in order to improve your cognitive health and improve your chances of either, not developing the disease or delaying the progression of the disease. So the bill as it stands currently is a reporting only bill. So it will require Medicaid and the department to report on what the cost would be to implement this for Medicaid, as well as for what it would impact premiums on. So it's just a reporting bill at this point. We certainly think that it is a cost saving measure when you get a more accurate diagnosis earlier on. It prevents, misdiagnosis. It provides a better opportunity for developing a care plan and a treatment plan. So we really do see this as a cost saving, but we also understand and respect that this is, something that the state needs to look at carefully. So we see this reporting bill as a good first step in moving us towards that direction. The other initiative that we're working on right now is Representative Noyes originally was working with us on this, but we have the Dementia Respite Grant Program in Vermont that provides funding through the AAAs, where someone who is caregiving for someone can receive services to either have someone care for their loved one in their home or outside of their home for respite. So it's a short-term period of time that they get funding for to have their person that's living with the disease either have someone come into the home for a few hours so that person can go to the doctor or go grocery shopping while still knowing that their loved one is cared for, or an adult day program and spend some time there and utilize those funds. So the program, the Dementia Respite Grant Fund, has not been increased since 2003. So it's at $250,000 in the current budget, and it has not been increased since 2003. And we're all deeply aware that, costs are much different now than they were over 20 years ago. So we're advocating.
And we have a different population.
And a very different population. Yeah, there's definitely a lot of need. So we're advocating for a $500,000 increase to that fund. We certainly understand, again, that it is a challenging budget year, but we do see that when people are given respite and caregivers have that opportunity to take advantage of respite, it delays the possibility of them burning out and delays the need for potentially someone who is living in their home currently to need to go to a more restrictive care facility that then has to be paid for by things like Medicaid or, other crisis situations where a caregiver is burned out and someone who's living with a disease or that caregiver gets to a crisis point that then involves, potential hospitalization or other costs to the state. We are also advocating in that for a $100,000 pilot program to have be run through the state that would provide funding to organizations in the state for dementia capable programming. So, and this is specifically for Washington and Rutland counties. Those are two counties that were really, really harshly impacted post-COVID for their adult day programs and services and supports that are available for people living with Alzheimer's and dementia. So this pilot program will provide an opportunity for staff and volunteers at organizations like senior centers, libraries to apply for this grant. Those volunteers and staff will get trained in dementia capable programming so that they can develop programming, they can understand the disease better and provide a safe and appropriate space for people living with the disease or their care partners to come and receive that kind of respite, as well as social engagement that's so important when you're isolated and living with the disease.
I have a question on that testing. If it's included there are other states that have insurance cover this.
Yeah.
And what is the percentage? Do you know, this is probably a kind of a long shot question, but I was wondering, what's the uptake on it? Like, do people actually seek out the test? Like, you think about all the things and you could be tested for. Does this one in other states kind of rise up, and do people actually say, I'm interested? Like,
That's an
At
interesting
a-
question. Yeah, I mean, I think certainly people should always be their best advocate in your doctor's office, but for
Right.
Alzheimer's specifically, a biomarker test would be utilized in conjunction with a cognitive assessment
Right.
and a review of that person's medical history. So this would be for diagnostic purposes only, and the language of the bill as it was initially proposed is very limited to require that there is, scientific evidence and medical, need to ensure that this test and paying for this test is appropriate and would have a benefit to the care plan and the treatment. So I don't know the specific data on that, but this is and you're correct, this has passed in 19 states for both public and private. And then I believe it's 2 states have only passed it for public, 1 state has only passed it for private. So a lot of states have passed this and, certainly see the value in ensuring equity and access, as well as the cost savings in getting a more accurate and earlier diagnosis. But in terms of people seeking out and asking for it, that will be an interesting question that I can definitely look
Yeah,
at.
and so it's not if you're, going to seek help for cognitive or,
Yeah.
and the doctor prescribes it, it's not covered now?
So it depends on the type of biomarker test and what type of insurance you have. So,
Gotcha.
Medicaid does cover some biomarker tests right now, and some private insurance covers specific biomarker tests. This would just be a requirement that any biomarker test that, again, fits that narrow window of scientific evidence and appropriate to the care plan of an individual, then it would be able to be covered.
Right.
So it's not that there's no biomarker test being covered by Medicaid or private insurance. It really just depends on the plan that you're on.
Yeah. And for anyone else, yeah, go ahead, Representative.
What the biomarker testing could show you, because, diagnostically, how much information can it give you?
Yeah, so the biomarker testing for Alzheimer's would show how much amyloid you have currently in your brain. And so that is the hallmark that we have currently to best identify whether or not someone's living with Alzheimer's or dementia. So there are currently, a number of different tests, spinal taps, scans that are utilized and have been utilized historically for identifying that in people. Excitingly though, I believe it was middle of last year, the FDA did approve a blood test for diagnostic purposes. So that's much cheaper, it's much quicker, much less invasive way to identify that plaque buildup.
And it can identify the degree.
It can identify the amount of plaque, yes. In some cases, it depends on the test though. Yeah. Yeah, of course.
And interestingly today, though, Alzheimer's is not a rare disease. There are things that present as Alzheimer's that are rare diseases. And today in health and welfare, they're taking up the bill for the Rare Disease Advisory Council in Vermont. We're one of the few states that does not have one. So though Alzheimer's not rare, sadly, there are other ones that mimic it or are very similar to it that are, so.
Yeah, I know an advocate from Massachusetts who was originally diagnosed with Alzheimer's, and he eventually was able, through getting more testing, to show he doesn't have Alzheimer's. So he was diagnosed with the disease. They were planning his treatment, his care around that diagnosis, only to find out that he doesn't have Alzheimer's.
Yeah.
And it's an entirely different disease. So that again really speaks to the need to accurately have diagnoses for things like Alzheimer's and any kind of disease.
Lewy body
So that
dementia
you're-
or.
Right, not running through 7 different doctors. We have an advocate that, went to 6 or 7 different doctors to try and get a diagnosis, and having these biomarker tests that give us better, accurate diagnoses, it can really limit that and limit the amount of time that someone takes finding a disease, as well as the cost associated with a diagnosis.
Yeah. Okay. Any other questions?
What's the latest on cause of Alzheimer's? Theories 10 years ago that have proven not to pan out, really?
Yeah.
And is there a new consensus, or is that just up in the air now?
So I think there's still a lot of research going on. One thing that we really had exciting come out recently is the US Pointer study, and that speaks to the steps that you can take, preventative steps you can take to improve your cognitive health that will diminish the potential of you having Alzheimer's and dementia. So obviously it is not everybody that has Alzheimer's dementia did not live a healthy enough life or did not manage their blood pressure or exercise enough or cognitively engage enough. But we are seeing that a lot of people, if they engage in these preventive strategies, improve their cognitive health. It really diminishes the opportunity or the chance that they'll develop the disease. So I don't know if there, as Representative Noyes pointed out, there's a lot of different diseases that can mimic it. So we're still, with these biomarker tests, we're getting better at diagnosing and identifying. But there's also different types of dementia, like Lewy body, vascular, all of these different things. So one singular cause, I don't think that we've determined yet, but we are in, again, a really exciting time in terms of research on that. And the US Pointer study really does give us a lot of interesting information about the preventative steps that you can take to protect your cognitive health.
I'm wondering, you gave us some statistics about the number of caregivers there are and the number of hours of care provided. What does the landscape in Vermont look like with respect to Alzheimer's specific nursing homes that are available? And is it meeting the need? I'm not familiar enough to know that how many times or what percentage, or is it everyone that potentially can be cared for at home, or do a certain percent need to be in a nursing facility? Yeah,
broadly, I think we certainly see a pressure on our long-term care facilities to meet the needs of individuals, and that, there are a lot of challenges and pressures on them right now from a lot of different angles. In terms of Alzheimer's specific, I can definitely look into that and drill down and get you that information. Yeah.
Great. Online, anyone have any questions or any comments they'd like to share today? All right. So tomorrow we're going to have a ceremonial reading on the floor of a resolution. And then coming up also, hang on, we have another one later in the month to recognize Age Strong Vermont. And that is going to be on the 29th, I believe. Yes, 29th, which we'll look at what's going on with just recognizing the work that's been done for Age Strong. So I just kind of set that up a couple hours ago. So there'll probably be some more coming out on that. Oh, someone put something in the chat. From the perspective of a community-based senior center, it's very difficult to find care. Recently had a family have to place their loved one in upstate New York because there was nothing available in Vermont. Looked for several months. And this is Andrea from the Heidenberg Senior Center. So yeah, I know that, and we're also, earlier this year, we heard that the need for nursing home level of care in our state is going to not be able to keep up. So, it's not good that someone had to go find a place in New York, but yeah, we're going to have to figure out how we provide access to that level of care, whether through enhanced residential care at res care or nursing homes, memory care. It's going to be a topic that we're going to be talking about a lot more than we are about education too. So.
Well, thank you so much. I will say tomorrow morning we're having coffee in the cafeteria and our advocates are going to be there. Also in your mailboxes, you'll find our schedule for Advocacy Day for other opportunities to engage with us. So I hope to see you there. And I really appreciate the opportunity to address you all this morning.
Great. And I just, Aaron, do you want to, Aaron just put something in the chat, exact same thing. So they're also having trouble finding care for individuals and the people that they're serving. So thanks for being here today. All right.
Thank you.
Great. We'll see you all later. Next week, we're probably going to have some long-term care, speaking about just that and how people are receiving care. I'm still working on, you'll see an announcement, but maybe someone from licensing and protection or our long-term care ombudsman who's here in the room with us. So we'll be talking about that later today. All right. Thank you, everybody.